Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is the COVID-19 briefing for British Columbia for Monday, December the 21st. Tomorrow, December the 22nd, we'll have a written briefing at 3 o'clock with COVID-19 case numbers and other relevant information with respect to the pandemic in BC. On Wednesday, December 23rd, we'll be giving an in-person briefing here, Dr. Henry and I, at 3 o'clock. That briefing will include some modeling data, some data about the course of the pandemic in British Columbia that will be provided by Dr. Henry. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. And I do just want to acknowledge that we are speaking to you today from the traditional and unceded territories of the Lekwungen-speaking people, now known as the Songhees and Esquimalt First Nations, and we're very grateful to be talking to you from these lands today. As you know, today we're reporting for 3 reporting periods, and from Friday to Saturday we had 652 new cases diagnosed with COVID-19 in the province. Saturday to Sunday, there are an additional 486 people diagnosed with COVID-19, and Sunday to today, 529 new cases identified. That gives us a total of 1,667 people diagnosed with COVID-19 over the past 3 days, 14 of whom were epidemiologically linked cases. That brings our total in British Columbia to 47,067 people who've been diagnosed with COVID-19. Of the new cases, 283 people were in Vancouver Coastal Health Region, 1,084 people were in the Fraser Health Region, 21 were in Vancouver Island, 189 people were in Interior Health, and 90 people were in the Northern Health Region. We now have 9,718 active cases in all areas of the province, 341 of whom are in hospital, 80 of those in critical care or ICU. We do have probably slightly over 9,651 people who are under public health, active public health monitoring. There's been a data transition in the Northern Health, so we don't actually have the active cases under active monitoring in Northern Health today. We'll be updating that tomorrow. And in addition, we have 35,455 people who've recovered from COVID-19. As we know, we've had a number of outbreaks in long-term care, and that reflects in the fact that we had 41 people in the past weekend who died from COVID-19, bringing the total number of people who've died to 713 in British Columbia. And of the new people who have died, most of those cases, again, were people in long-term care. This weekend, families, care providers, and communities have lost loved ones. We know that this is such a challenging time, and we mourn with you, and we feel your loss. We have 5 new healthcare outbreaks at Fleetwood Villa, Nicola Lodge, the Mayfair Seniors Living, the Gardens at Qualicum Beach, and Heritage Retirement Residence, and 5 outbreaks that were declared over at Bradley Centre, White Rock Seniors Village, Royal City Manor, Harrison Point, and Aged Care Harmony Court Estates. So we have 55 active outbreaks in long-term care and assisted living and 6 in acute care units. And we currently still have 1,424 residents and 792 staff with active cases. In addition, we've had new community outbreaks at 2 Coastal GasLink locations in the Burns Lake and Nechako local health areas. Northern Health is working with Coastal GasLink and with Pacific Atlantic Pipeline Corporation to address the issues that are occurring in the areas along this project, including issuing orders around safety staffing and COVID safety plans that must be reviewed by Public Health and Northern Health before the operations start again. Last week, we immunized 3,644, mostly healthcare workers, who received the COVID-19 vaccine in the Lower Mainland. And today I can confirm that vaccine deliveries have arrived in every health authority in British Columbia. As we saw last week in Vancouver and in Fraser Health, teams in the other health regions are preparing, even as we speak, to get immunization clinics underway in the coming days. What we've seen so far is that things are changing quickly and will continue to change quickly as we get a better sense of how much vaccine is coming when. But the last week was a great kickoff for our immunization programs across the province. And as we go through the coming weeks and months, we will have more information and more details about exactly how much vaccine and who is eligible to receive the vaccine and where and how. So please be patient, and as information becomes available, we will be sharing it. I know as well many people have questions about the new genetic variant of the virus that has emerged over the last few days in the United Kingdom. We have seen from the very beginning with this virus that it does mutate, as we expect, with RNA viruses in particular, and this one mutates relatively slowly. And we did see these slight differences if we think about the comparison of people who had brought their illness from Washington State, for example, compared to Iran or China. What we see in what has arisen in the UK is a new variant that has a number of mutations, as many as 17 mutations, different changes in parts of the virus. The evidence has shown that so far it does not seem to increase severity of illness. However, it does seem to mean that the virus can transmit more easily, and that's something that we're still trying to understand and figure out. And it could be because one of the changes, the mutations, has made the virus more easily able to attach to those receptors that allow the virus to get into our body and start the infectious process. So that's one of the things that scientists are looking at very carefully to see if there's any other changes that this virus mutation will enable as well. And we've had a number of meetings over this weekend to try and understand the impact of this and whether we've seen anything here in Canada. And as you know, all of my colleagues across the country and the provincial health officers are watching this very closely. Yesterday, the Government of Canada put in a temporary travel restriction stopping all flights from the UK so that we can get a better handle of where this might have been and what measures we need to take to ensure that it doesn't get introduced and spread widely here in Canada. This pause gives us that time to put in appropriate protective measures, and we'll be working together to determine which those will be. As well, I've asked our lab at the BC CDC to review the whole genome sequencing. So from the very beginning, we've been looking at the genomic sequence of the viruses that we're seeing here in British Columbia. And to date, we have not seen this variant here in British Columbia. We have seen some mutations, and particularly when people come from different parts of the world. And we've seen some of the mutations that are seen in the 17 changes from the virus that was found in the UK. But the strain that is circulating in the UK, we have not seen in Canada or in British Columbia. I think the other important thing to note is that so far, these changes don't seem to cause more severe disease and don't seem to interfere with the ability of vaccine to give people protection. And as well, one of the things we're concerned about is that it might affect the ability of the test to pick up the virus, and that does not seem to be the case either. So those are good things. However, we will be watching very carefully and monitoring this over the coming days and weeks. As we all know, COVID-19 spreads quickly, but shows up slowly. It can take days or weeks to understand, and when it does appear, we know it can cause serious and life-threatening illness, and that, in turn, can overwhelm our hospitals and our long-term and our acute care system. We are starting to see a leveling of our COVID-19 curve in BC, and that is good news. but it is a leveling at a very high level, which means that transmission continues to happen, particularly in the lower mainland, but also, as we've been seeing, the interior and the north are having quite large transmission events relative to the population. And we continue to see hundreds of new people each day with confirmed cases, and they expose others. With the restrictions that we've had in place, the number of people who've had close contact has decreased, but it is still a substantial number, many of whom become ill themselves and require care and treatment in hospital. We have to remember that people getting sick today were in contact with others days ago, as much as 2 weeks ago. That is why the actions we take today make such a difference to all of our well-being tomorrow and next week and the week after, and why it is so important today and this week to stay small, to stay local, and continue to use our layers of protection as the holidays approach. If you are in doubt, err on the side of caution and choose to stay away right now. This is how we will get into the new year with reduced cases and reduced risk. As we all know as well, and I was talking to many of my colleagues and friends on the front lines, our healthcare workers and teams and our public health teams have been working nonstop to provide care and to provide that public health connection to all those who need it, and they are in need of a reprieve. Today, on this longest night of the year, let's do our part to give them the break they deserve to. Let's all share some light with our healthcare workers and show them we care for them as much as they care for us. I ask you all to be part of our team doing that. We want to finish this year and start 2021 in the best possible position. We know we have vaccine now. We know that it's going to take time for us to get everybody protected. But the steps we take in the last days of 2020 are going to ensure a brighter, healthier, and safer 2021 for all of us. I have also made my own personal commitment to celebrate safely, to stay small, so that I can keep my community, my friends, the people closest to me safe. I ask you to do the same. Make the commitment today. Have a safe holiday celebration. Reach out to those people in your community, your friends, your family, but do it in a way that's safe. Together, let's make this holiday season a safe season for all of us, so we can put this year behind us and start 2021 by moving into the light. Let's also, of course, continue to do this with kindness, continue to be calm, and continue to be safe. Thank you.
Thank you very much, Dr. Henry, and I wanted to start by expressing and sending my condolences, those of the Premier, those of the government, those of people in BC, to the families, the friends, the caregivers, the communities of the 41 people who passed away this weekend over the past 3 days due to COVID-19 or related to COVID-19. 17, those people were in Fraser Health, 14 in Vancouver Coastal Health, 9 in Interior Health, and 1 on Vancouver Island. And just to note that the 9 in Interior Health is significant and shows the potential impact, particularly in long-term care, of transmission of COVID-19. We, I think, before this weekend, only had 8 people pass away in the entire pandemic in Interior Health. I also wanted to, for all of those people in Interior Health, on Vancouver Island, people in Metro Vancouver, all of the people who passed away from COVID-19 this weekend, our hearts go out to you. This is a very, very difficult time. This time of the year makes it more difficult for many people. Our inability to, in a way, properly celebrate people's lives and properly mourn makes it more difficult. And I want to say that we are thinking of them, standing with them today. Also want to acknowledge the report of the coroner today, 153 people passing away due to suspected drug toxicity deaths. in November. That's, of course, less than last month, but it is an enormous number, 5 people per day, and significantly more than this time last year. I want to say that we continue to work on both of our public health emergencies in BC and are thinking of those friends, of those family members, of those communities who have lost lives in the overdose crisis in the last month, the overdose public health emergency. As many of you will know, our healthcare system continues to operate at full strength, but also at maximum capacity. We had yesterday, for example, 4,641 emergency room visits. That's significantly below what we would have typically at this time of year, but nonetheless, very significant and busy emergency rooms, 9,718 active cases of COVID-19. With respect to our overall capacity, we are at about 84.8% of our regular base beds filled right now in our acute care hospitals. That's dramatically below the usual level of occupancy at this time of year. The overall beds are about 66.6%, or 2/3 of beds when you count the surge beds we've added. In critical care, those numbers are 72% of our base critical care beds and just under 50%, 49.8% of our critical care beds when you include the surge beds that we have added. That's 341 people in hospital from COVID-19, due to COVID-19, and 80 in critical care. As Dr. Henry has noted, we'll be providing modeling data on Wednesday to describe the state of the pandemic in BC and to lay out, as we have consistently done since the month of March, where we are in the pandemic in BC and why it's so important right now for all of us to dig in. I wanted to give you an update, as I do on Monday, on the PPE that's come in over the past week. This past week, 5,060 N95 or equivalent respirators arrived in BC, 2,371,000 surgical or procedure masks, 10,820,625 pairs of gloves, and 108,116 gowns. Also, to bring you up to date, Dr. Henry spoke of the number of people immunized in our COVID-19 immunization effort this past week, but we also continue to have a very significant effort to deal with influenza and the distribution of an influenza vaccine. That number as of December 17th is 1,363,455 doses have been administered to British Columbians. There's a reporting lag in this, so it's actually more than that, of 30 days for pharmacists and physicians and nurse practitioners to report and to bill, but that is a very significant achievement. I want to just underline the extraordinary work done by pharmacists in BC. I think that they, like many others, have done extraordinary work throughout this pandemic. Consider that last year, in total, in the entire influenza vaccine effort last year, pharmacists administered 724,256 doses to date this year. And we're just partway through the campaign. Pharmacists have administered 1,001,204 doses. So last year it was about half of all doses administered. This year it's approximately 70%. Finally, many of you may have some questions about the NHL, which is a little bit in the news. Just to say that, as you know, the NHL has made a proposal with respect to I guess it would be the 2021 season of the league. We received that proposal just in the last few days, and obviously we'll be looking at it. As you'll be aware, the NHL, in a time when COVID-19 was less prevalent in our country and in our continent, engaged and had a bubble for its players that turned out to be, for them, quite successful. They are proposing a different system on this occasion, and our public health officers across the country are reviewing that. Like I say, we've received it and we're briefed on it on the weekend, and we'll be responding to it in the days to come. I wanted to say in closing, we know from our own experience that COVID-19 is ruthless in its mission to spread. We know from experience that our fight to loosen its grip must be, relentless. So our primary job is to stop the spread, and we do it by bending the curve, not the rules. If we're unsure if our plans stop the spread or our actions bend the rules, we rely on our touchstone. When in doubt, rule it out. I ask everybody in this Christmas season to do as Dr. Henry has suggested, as many other people have suggested, is support one another. Make the extra phone call, connect with people on FaceTime, possibly, and this will be up to people because this was generated from the community on a day like December 23rd. Why don't we all get out and make noise for all of our frontline workers at 7 o'clock on December 23rd and try this week especially to let them know how much we support their extraordinary efforts in this difficult time of the year. I think it's pretty important for all of us right now. There is great hope currently right now with vaccines, but there's also a huge challenge, as you see in these numbers, which are better than last weekend, but still much, much too high in terms of cases, and simply much too high in terms of the number of people who've passed away. So I ask everyone in every way that they can to dig in over the Christmas holidays, to do what they can to stop the spread, to protect the ones they love, and to protect the ones that they don't know. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle des 18 et 19 décembre, celle des 19 décembre et 20 décembre et celle du 20 jusqu'au 21 décembre en mi-journée. Il y a eu 41 nouveaux décès liés au COVID-19 durant ces 3 périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 765 personnes décédées du COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Pendant la première période de référence, nous avons eu 652 nouveaux cas. Pour la deuxième période de référence, nous avons eu 486 nouveaux cas. Au cours des dernières 24 heures, 529 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de COVID-19, 341 personnes sont actuellement hospitalisées, dont 80 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up only. I would also ask that you please unmute your phones. You will not be audible until your name is called. First question today is from Farhan Laljeez, TSN.
To Minister Dix or Dr. Henry, you mentioned earlier that you've just received the Vancouver Canucks and the NHL proposal in the last couple of days and that it was different from the bubble. What do you need to see to satisfy the government that this could be done in a safe way?
Yeah, so I think, first to say that the NHL and the Canucks in particular have a proven record of doing the right things and have been very strong in terms of their protocols. So we are looking at this in detail, and I've been talking with my colleagues across the country, and we'll be responding with our advice in the coming days.
Do you have a follow-up for? Oh, sorry.
It's exactly right. All of the medical health officers, there's obviously those from Quebec and Ontario, from Manitoba, from Alberta, and from BC, and they'll be looking at these proposals. They are obviously significantly different from what was presented in the summer, the plan, which was a bubble in the summer, which occurred during a time of relatively low COVID-19 caseloads in Canada and in North America. So they're taking a different step, shall we say, maybe say a step back from that, and that's something to be reviewed. But, I think it's important that we do what we always do here in BC, and I think all the medical health officers across the country take a look at that, and then we'll make some decisions in the days to come as to whether the plan meets the needs of people. I would also add that there are many other people and many other leagues that play hockey, and it's important that all of them be treated fairly in this process, not just so there's not this is not the case where there'll be simply one standard for one group of individuals and one standard for another. This is a very serious time in the COVID-19 pandemic. Everyone is coming together. Everybody is making extraordinary sacrifices, and we see that every day. And we appreciate, I think, the incredible support that we've received from the Vancouver Canucks over time, their commitment to this effort as well. But, there's also lots of things before Dr. Henry, the other provincial health officers, so we will take a little bit of time to respond.
No, that's it. Thank you.
Thank you. Next question is from David Molko, CTV.
Hi, Dr. Henry. David Molko, CTV here. I just want to draw you out on that new UK variant. I understand the limitations of what we know right now. Can you give us a sense of how concerned you are, specifically what mutations like this broadly mean for whether the vaccines we have right now may not be effective enough down the line? Experts have suggested it could take a year or years for mutations like that to happen. What are your thoughts?
Yeah, so this is an RNA virus, which means it only has a single strand of genetic material. Most of us have, or many creatures have double-stranded DNA, which gives you a spell checker. With an RNA, you don't have that spell checker. So we know that mutations are more common in those types of viruses. And we see influenza is probably the one that changes as rapidly as we could possibly imagine, which is why we have to develop a new vaccine every year. So it's not unexpected to see mutations, and we've been following this very closely from the very beginning, recognizing that we can actually tell where things have been and where they've come from by these mutations. What was a little surprising is that just by random chance, probably, this one mutation, with a number of mutations on this one variant arose at the same time. And it may be that because it transmitted more rapidly, that's why it sort of took over. This is what we see happen sometimes, that one of the mutations may just randomly confer an advantage to that virus, which means that it will take over and spread more rapidly, or it will be the one that will infect more people. So it's not surprising. We do still need to watch very carefully. When we're looking at the vaccine, all of the vaccine candidates and the ones that are approved so far are recognize the spike protein. So the mutations that we are seeing, at least from the data I've seen in discussion with my colleagues who know this way more than I do in the genomics world, there's not anything that would be worrisome about the vaccine being effective with the mutations that we're seeing so far. But it is obviously something we want to watch very carefully. There was some, we're still relatively confident that this virus doesn't change as quickly as some other viruses, which means potentially the vaccine could last, the vaccine protection could last longer. But the reality is we just don't know that yet, because we've only had this virus and the genomic sequence known for about 11 months now. And there's much more that we need to learn in the coming days and weeks and years ahead. David, do you have a follow-up?
Understood. And Dr. Henry, for the average person in British Columbia, what, if anything, in your view, does the emergence of a new variant like this, what does that change?
Well, right now, it doesn't change anything for us. It's worrisome to me that it seems to be spreading more quickly. So if there's a virus that's spreading more easily that gets introduced here in BC at this point, that would concern me, because that means that we would, the whole start of our immunization program and recognizing that the amount of vaccine that we have is not enough to protect everybody right away. It just makes me want to make sure we're protecting people as quickly as we possibly can, because something that spreads more easily will cause more illness, will therefore lead to some people ending up in hospital, and that's what we want to avoid. But really, it is behaviors. It is us doing those things that prevent transmission that's going to stop any of this virus from transmitting, whether it's this strain or not. It just means our little bit of leeway that we might have had, and we saw that in the summer, it changes during this time of the year. If we have a new variant that makes it transmit more easily, we have to be even that much more careful and more fastidious to protect each other and to stop those chains of transmission.
Next question is from Moira Witten, Tai.
Hi, good afternoon, Dr. Henry. Thanks for taking my question. Earlier this month, you said you wouldn't allow more visitors in long-term care and assisted living, but that you would allow perhaps more frequency of visitors, the same visitors that are already designated and allowed to enter. I'm wondering what your response is to the call from the BC Civil Liberties Association and the Seniors Advocate to do this as soon as possible with the holiday season, what will be many seniors' last holiday season in long-term care approaching, and what your timeline is on this change.
So I think what we said was that we want to make sure that those requirements around essential visits are implemented in a way that's consistent around the province, because what we were hearing was people were not being allowed to be designated as an essential visitor, and many of them absolutely were. So that was our focus over the last little while. As you know, as the increased levels of transmission in the community have made it even riskier in long-term care, what we're trying to do is make sure that we maintain those safe visits that have been in place over the last few months, and really the focus on being able to safely visit in long-term care is why we are immunizing both healthcare workers and people as soon as we can, residents in long-term care, because that is really going to make the difference in protecting them and making sure we can have those real visits with our family in a safe way as soon as we possibly can.
Do you have a follow-up, Moira?
I do, thank you. On the vaccination strategy, I know that it's still rolling out just within healthcare workers, but when you think about creating a successful vaccine strategy for the general population, there are a number of people who are quite skeptical, and including communities like Black and Indigenous people living in British Columbia who have reason to, distrust public health advice. How is the province approaching, those community-specific concerns as you start crafting that broader strategy?
Yeah, those are things that we're concerned about. We know that there are challenges with what we call vaccine hesitancy, and people very rightly have questions. This is a new vaccine, particularly the one that is licensed for use or has a notice of compliance, as we call it in Canada, and hopefully the Moderna vaccine will also get that soon. These are new technologies, new platforms. People very rightly have a lot of questions, and we've been seeing that in the clinics. I was at one of the clinics last week and talking to people about this, and what do you need to know? What do you need to understand to know that it's safe? I think part of our the important messages that are coming out from the public health community and from Health Canada about the processes for assuring that the vaccines work and that they're safe, and that we have not lowered or changed any standards. It's still a very high standard, so that we are confident that vaccines are safe and that they work, and what populations they work in. So we have started talking about that. We have our strategies, and healthcare workers, like everybody else, have questions about the vaccine and the new vaccines. So we are putting together the materials to answer those, and also to have it in the languages that people need to get the information in. So we are working. I've had many conversations as recently as last week with the First Nations Leadership Council. I was privileged to have some time to speak with them about the vaccine. So yes, I think these are very important considerations. We know that this virus the pandemic has differentially affected certain populations, and those are people who need to have equal or equitable access to vaccine so that they can protect themselves and their families as soon as possible. So we absolutely recognize that and are putting out as much information as we can about how the vaccines work, about how they were evaluated, how we ensure their safety, how we monitor very carefully for every vaccine given to make sure that we pick up any signals that arise. And we saw in the UK and in the US, there were some allergic reactions to the vaccine. So we've adapted our materials to help people understand what that means for you, and we'll continue to do that. There are many, many moving parts right now, including there's the amounts of vaccine that we're getting at different times is still up in the air. So as we move through the next few weeks, hopefully that will become more certain, and then we'll be able to tell people with a bit more certainty, what time frame are we looking at for when you might be in line for vaccine. So that's something that we will be giving you as much information as we can in the coming weeks.
Arthur Williams, Prince George citizen.
Yes, Dr. Henry. I was hoping to find out a little bit more about the vaccination strategy outside the Lower Mainland, particularly in the north and the interior, where certainly we've seen a surge in cases over the last little while.
Absolutely. So our strategy is similar in that the target areas are to protect those most at risk as a start, and that we have in common across the country and across BC. Our challenge that we have right now is last week we were only allowed 2 areas to send vaccine to, and they both had to have an ultra-low temperature freezers. So we focused on the Lower Mainland because, as we know, that's where rates and numbers of transmission of disease were highest, but also where they were ready to start and they had the appropriate things in place. So far, Pfizer still requires us to only deliver vaccine at the point of arrival of the shippers with the ultra-low temperature freezers in sight. So that restricts things a little bit. We were hopeful that once the supply chain had been proofed across the country, that we would be able to break down the trays of 975 doses and be able to take them out to different areas. We have not yet had that release from Pfizer, so we are still limited. We're hoping it's going to come in the next few days, and then the strategy will be to be able to take vaccine to long-term care homes and to immunize residents and staff at the homes. So right now, this week, at least today and tomorrow, the immunization clinics that will be starting tomorrow in the north and in the interior will be focused at people coming to receive vaccine. But as soon as we can, we'll be moving out into the community. As well, we're hopeful that the Moderna vaccine doesn't have as strict requirements for ultra-low temperature freezing, and it can be broken down into much smaller numbers of doses. And when we've developed a strategy, an initial part of that strategy for when we receive Moderna vaccine, when it becomes licensed by Health Canada, that we can bring that out to a number of remote and isolated communities and into care homes themselves. So that'll be the first phase of how we're moving through this.
Arthur, do you have a follow-up?
Yes, in terms of, I think it was last week you mentioned there would be 9 sites starting this week outside of the Lower Mainland. Can we get an indication of what those sites are? And in particular, I'm hoping to find out, given just the size of both the north and the interior, if there is, only one site in the north, presumably Prince George. For someone in Fort Nelson, a healthcare worker or whoever, that's a long way. Any, mention of sort of how that's going to work, how those folks in those much outlying communities may be able to get access to the vaccine?
Yeah, so this week there is 9 sites that vaccine has been delivered to. Some of them are still in the Lower Mainland. There's a couple of sites on Vancouver Island and interior in the north. There is 1 site, as you say, and it's still a very limited amount of vaccine. We don't have a lot of vaccine yet. We're only getting about 30 trays between now and the first week of January. So it is a small amount to make sure that the delivery system works, that all of the things are in place for the clinics to get up and running. So they have a plan in Northern Health to use up all of those doses in the area where the first shipment is being received. And yes, we have a plan for subsequent doses and how they will be broken down, but a lot of it depends on us being able to being able to break down the Pfizer vaccine and transport it to other places, because as you say, it's not feasible for somebody to go from Fort Nelson to Fort St. James or whatever. So yes, that is a plan. The other part that we're looking at is when we start to receive the Moderna vaccine, being able to take that out to communities as well. So I'm being slightly vague because so much of it is still up in the air. We're waiting on the licensing of the Moderna vaccine and confirmation of how many doses we're going to receive when. We are waiting on the notification from Pfizer that we can take the frozen product and transport it to places away from the place of arrival of the shippers. So it is challenging and frustrating, and we are talking many times a day about trying to get this through. But the important thing is that, yes, we are now in the place of planning for how we'll get to every single community across British Columbia.
Next question is from Ian Bailey, Globe and Mail.
Dr. Henry, there's a question and answer release from your publisher about the book that you and your sister have written. It says that you are going to donate your advances to charity, but I'm just curious, what about other revenues from this project? And if you're not going to do that, is that fair for a public servant to profit from work they do on the side of their work as public servants?
Yeah, well, I can say that this book was something that I wrote on about my 6 days off, and it really is about, the personal story of what we went through, my sister and myself, during a period of time in March, where we were all going through many challenging times. And yes, I used the opportunity to make a donation to First Book Canada, and it's an organization that provides support for children around Canada to make sure they have access to literary supplies, books, and education. And that is something that is near and dear to me, and something I feel is very important, particularly as we know that young people have suffered from the challenges through this pandemic in the last few months.
Ian, do you have a follow-up?
Yeah, I'm going to make it sort of a split follow-up on that first question. Will you donate all ongoing revenues beyond your advance to charity? And this may be also a question for Minister Dix. How in this book do you sort of deal with breaching or reporting on, shall we say, the confidences of conversations you may have had with the Premier, with Mr. Dix, with other members of Cabinet? Are you going to report on those conversations? And if you're not, what value will your book have?
Well, as with all books, and I suppose all written materials, people will judge its value when they read it. But I know that Dr. Henry, when I became Minister of Health, gave me a visitor in the Ministry of Health office. She was not the provincial health officer at that time, but gave me a copy of her current book, which I recommend to everybody because of I think it's a real contribution to public understanding of the very issues that we weren't dealing with in the same way then, we'll do in part, and we are now. And so she's an extraordinary person. I think her insights are going to be of great value. All of us, when we reach public office, sign oaths of confidentiality. I have total confidence in Dr. Henry in every way. This is a person of absolute generosity and integrity, and I have absolute confidence in that what she's going to present, one, will be vastly readable, and I look forward to, I'll be first in line at my local independent bookstore to pick it up, vastly readable, and secondly, will, as she always does, be consistent with her I think, extraordinary commitment to public service. I must say that I happen to know that I've taken probably about 7 days where I haven't dealt with the pandemic in BC since the beginning of the pandemic, and that Dr. Henry has taken less. The fact that she's able to write anything in her off hours is a matter of extraordinary, I think, achievement. But in any event, I'm looking forward to the book. I think it's an excellent contribution. I know there's going to be no issues of the kind that you've raised, Ian, and I'm looking forward to reading it and to getting her insights, because there is, as in every story, there is the public policy journey. There is, of course, an epidemiological journey that we've all been living, and then there are personal stories, and I'm looking forward to hearing what Dr. Henry writes. But it won't be for a few months. So, in any event, there are, as far as I'm concerned, no issues.
Next question is from Cindy Harnett, Times Colonist.
Hi, thanks so much for taking my question. If I can just return to the delivery of the vaccines, can I confirm that's 2 sites on Vancouver Island that we've had shipments delivered to? And what is the time frame for that you would kind of foresee or that you're planning on or hoping for all healthcare workers in long-term care and COVID settings, and then all long-term care residents? When do you see them all having been vaccinated, please?
Yeah, so I'm getting the only one. I'm pretty sure there's two sites on Vancouver Island that have received vaccine today. And yes, the focus is on starting with long-term care because we know we don't have enough vaccine to break the chains of transmission in our community yet, but we do have enough vaccine to protect people. The shipments that we're receiving over the next couple of weeks, sometime by end of January, we should be at a point where we have been able to provide protection to residents and workers and essential visitors of long-term care and the key frontline healthcare workers, people involved in the COVID response that need to be immunized, and then we'll be moving on from there to other priority populations. But there's a big but there because we do not yet have guaranteed numbers of vaccines coming in per week. We just found out how many doses we're getting for the week of the 4th of January. So there's lots of things that are still in flux, but the intent is to try and as quickly as possible provide protection to residents of long-term care and then assisted living and independent living and elders in our community.
Follow-up, Cindy?
Yes, please. So I'm maybe interpreting that optimistically as maybe something like March for all of the long-term care residents to be immunized. And my follow was actually, and you've broached this many times now, unfortunately, but we now have a church in Victoria where the minister is saying, people are allowed in malls, churches are delivering something that is more needed in the community, and they're going ahead with services. Is there anything more that you would like to say on that topic?
So in terms of the vaccine, I hope that we will have long-term care residents and staff protected well before March. But again, as you say, it depends on how much vaccine we get when. In terms of the church services, I think most of us understand that there's something fundamentally different than being together in a building for a religious service than a transactional service or something that's transactional in a mall, buying something in a store where they're in there for a very short period of time. We're wearing protection. It's not the same type of environment where we see transmission. And the virus doesn't recognize that you're in a church or in a home or in a mall. It recognizes opportunities for transmission. And the sad thing is that we have seen elderly people who have been ostensibly taking all the right precautions become infected in church and religious and faith services in many different settings around the province and around the world. And that is why we've made the requests and the requirements to try and protect people when we know that people need that religious services, that faith support right now in particular more than ever. But we need to do it in a way that's safe.
We have time for one more question today. For everyone listening, Dr. Henry and Minister Dix will release a statement with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Zara Premji, CBC.
Hi, Dr. Henry. So what is your direct message to people who are heading to Whistler over the winter break or at all right now while we have many public health orders in place until January 8th? Ontario is closing all ski hills as part of their increased restrictions that start on December 26th. Would you consider that here?
We've been talking about this quite a bit, particularly, we had a large outbreak at Big White, as you're aware. We've reviewed with the industry the safety protocols. We know that there's a lot of strong connections and people live and work in Whistler and Squamish and the Lower Mainland. But I am asking people to stay local. Stay in your local mountain. If you want to go skiing, we know that there needs to be measures in place to try and prevent the gatherings that happen around ski hills, and many ski hills have been very successful at doing that, and certainly Whistler has been very good about the lineups and making sure that the people aren't congregating, but we need people to do their own bit as well. What we saw in Big White, and we've seen it in Whistler, we've seen it in some other communities as well, that it's the shared accommodations and having those gatherings and parties and getting together with people in accommodations that are where the virus is transmitting. So we all need to do our part to stop that.
Zara, do you have a follow-up?
Yes. So first off, going to that same question, though, is it disheartening for you to see that people who are not from the Pemberton-Whistler area are gathering up in Whistler? And then also, can you clarify the number of total deaths in BC? Because the dashboard said 724 on Friday, but you said the total was 713 today, and Minister Dix mentioned 765 in French. And then can we get an answer in French on the Whistler and Ski Hill question, please?
Okay. I stand corrected. It is actually 765. My notes are incorrect. I think it was just not updated. So thank you for picking that up. The dashboard will reflect that later today. And did you want to... Oh, about Whistler. We want people to stay local. I know there's a lot of people in Squamish and in Vancouver and in who have places in Whistler where they live, and they live in both places. People need to use the basis of the orders. What we are suggesting to people is you stay local. Stay local, stay small.
Oui, je pense que en français c'est simple. Beaucoup de monde en Colombie-Britannique aime faire du ski, mais il faut autant que possible rester local, rester petit dans nos gestes et dans nos actions. Et cela est parmi les choses qu'il faut être local, c'est quand on fait du ski. Il y a beaucoup de gens qui ont des liens, les gens dans la région de Vancouver et Whistler qui ont des liens entre les deux municipalités, les deux régions, si on veut. Il y a beaucoup de monde qui voit en Whistler une site locale, mais je pense qu'il faut, surtout cette année, à s'assurer, avant de voyager, avant de partir, que c'est absolument nécessaire. Et je pense, et s'il s'agit du monde alpin, de faire le ski ou d'autres choses, il faut rester local autant que possible. Ça, c'est le message clair. C'est un message pour cet hiver. C'est un message pour cette saison de l'année. Et c'est un message fondamental pour tout le monde. Merci beaucoup. Thank you very much. We'll see you on Wednesday.
Thank you.